My name is Dr. Eric Arzubi. I'm chair of the psychiatry department at the Billings Clinic, and I'm a child and adolescent psychiatrist. Next, we're going to talk about discipline. So I think the word discipline sometimes might have a connotation, a feel that it's something harsh or means punishing, and that's actually not true at all. So the word discipline actually comes from a Latin word called discipulus, which means to teach and to guide. So when we think about discipline, don't think about yelling, slapping, these sort of harsh words that might come to mind when we think about discipline, but think about teaching and guiding. Ultimately, again, if we're trying to help raise a child that's kind, nurturing, loving, cooperative, becomes independent and a loving and a lovable child, we want to teach and guide, not sort of discipline in the way that we might commonly think of it. What we're trying to do is help a child develop morals, values, give them rules for behavior, guidelines for behavior, and standards for acceptable behaviors. This is all part of discipline, helping them to learn right from wrong and to feel secure and to develop trust in other family members and the right adults. Otherwise, we'll get chaos, confusion, and power struggles at home, and we know that doesn't work. So again, our goal is to try and raise cooperative, respectful, and caring children, and do that through the true meaning of the word discipline, which is to teach and guide. So establishing discipline can be a positive experience. It doesn't have to be a negative experience that includes sort of this chaos, confusion, and these uncomfortable feelings. And you know, one of the most important things when it comes to parenting is I'll often get questions in my practice about, you know, my child won't do this. How do I make him or her do this or that? Well, our attempts to, let's say, change behavior in a child is going to go absolutely nowhere if we don't have a positive foundation in terms of how we relate to that child. In other words, you know, if someone tries to put a child in a timeout, the timeout is going to be useless if there's no such thing as a positive time in. In other words, the time spent with a child needs to be loving, caring, nurturing, includes play, a quality time. So again, imagine if the number of interactions, let's say you pick the last 100 interactions you had with your child, and 95 of them are negative and 5 are positive, you know, a child won't feel like he has much to lose, or she'll have much to lose if there's a timeout. Well, gosh, my interactions with mom or dad are difficult anyway. What am I losing? So it's important, if we're going to try to think about having time out with a child, the time in with a child needs to be something positive and something that really gives the child a feeling of comfort, security, and love. So what does time in need to include? Well, it includes holding and touching your child in positive and gentle ways, playing and reading with your child, treating your child with care and respect, showing that you care about your child and their world. And as you think about making a discipline a positive experience, being aware of what's developmentally appropriate. In other words, what's appropriate for your child's age. Again, you won't be asking your 10-year-old to do the same things as asking a 3-year-old. They're different expectations based on the age. The other thing is being consistent, but be open to flexibility when necessary. So yes, it's important to have a consistent bedtime. Absolutely, we want to promote healthy sleep and healthy habits and predictability. But once in a while, if you let your child stay up a little bit later, that's okay. And if you have to skip bath time once in a while, that's okay too. So showing some flexibility is going to be important too. So there are 3 strategies that are going to be important for establishing discipline. Again, remembering that discipline is to teach and to guide. Number 1, behavior management. What is behavior management? Well, those are situations in which the parent has a pretty significant amount of control, and that is doing things like danger-proofing a home, feeding, dressing, putting a diaper on a child, redirecting a child from a dangerous situation, a dangerous place, or dangerous activity, and you know, some family rules that are really non-negotiables, and that might include disrespecting a mom or disrespecting dad, putting hands on someone else. But through behavior management, the goal is to help them start managing their own behaviors. And then over time, once you've started with behavior management, you can start transitioning into what's called behavior encouragement. So this is the second strategy. And so at that point, what you're trying to do is reinforce to the child that he or she is trying to do their best, show cooperation, and show respect and caring. So praise, so this is going to involve a lot of praise, and positive reinforcement, I think is important to highlight that positive reinforcement is a lot more effective than punishing. Again, anytime you see a child doing something that you would like to see that child do again, praise the child. You gotta praise the child. I'll often talk about catching a child doing something good, right? As parents, we're great at catching a child doing something we don't like. But how good are we really at trying to catch a child doing something good? And when you do, and if we can make a practice of it, you're gonna see a lot more positive behavior. So again, try to catch your child doing something positive or something good.